How to express breast milk. It's important to learn how to remove milk from your breasts. It can relieve breast fullness, soften your breasts, and make it easier for the milk to flow. Expressing your milk is also important to keep up your milk supply when you're away from your baby and make more milk when your supply is low. If you work away from home, someone else can feed your baby, or you can reserve milk for your baby in any situation. Expressing by hand is a learned skill that will improve with practice. This video will show you how to express your milk. Wash your hands well and have a clean container ready with a wide opening. First, and most important, is to start the release of your milk. To help your milk to flow, you should feel relaxed as well as connected to your baby. You can bring about a release of milk by gently massaging your breasts, seeing or hearing your baby, or even smelling your baby's blanket or clothing. The more relaxed you are, the easier your milk will flow. Stimulate your breasts with light stroking or gentle circular motions around your whole breast. This will usually bring your milk. The next step is to place your hand and fingers in the best position. A few finger widths back from the nipple. Place your thumb on one side of your breast and your fingers in exactly the same place on the opposite side. Now press back toward your chest wall. Press and roll your thumb and fingers together and then release. Press back, press and roll together and release. Press back, press and roll together and release. Press back, press and roll together and release. Notice this mother's first attempts. She is only pressing toward the nipple and not much milk is coming. But when she presses back to her chest wall, she is releasing milk from the denser breast tissue, and this results in more milk flow. Your milk may drip or come quite slowly at first, as this is a skill that comes with practice. Press back, press and roll together, and release. If you express colostrum, the first milk after birth, it may only come in drops, but this is enough for the newborn. The thick, often yellow milk has enormous protective benefits for the baby. Continue to press back toward your chest wall. Press your thumb and fingers together, then release. Once you press your breast back toward your chest wall, your hand should stay in that position with motion only from your fingers that are compressing your breast. The rest of your hand doesn't move. Breast tissue is delicate. Be careful not to slide or pull your fingers on your breast towards your nipple. This can make you sore. Also, avoid pinching or pulling your nipple. Removing milk should not hurt. If your fingers are too close to your nipple, your milk may not flow for long. You will release more milk when your fingers compress the denser breast tissue. Once your milk slows down to a drip again, you can move your fingers around your areola to clear other parts of your breast. Feel for where your breast seems fuller and compress those areas. Once one breast starts to slow down, change to your other breast. Continue alternating sides until the flow of milk is very slow. Hand expression is particularly helpful when your breasts are full or engorged, or if you are suffering from plugged milk ducts. It will help your baby latch on easier, as well as help your milk flow and clear the blockage. To maintain your milk supply, you should express as much as you can and as frequently as your baby would breastfeed. Remember, expressing breast milk takes practice. Relaxing, stroking your breasts, and being near your baby will help the milk come down. Press back toward your chest wall, press and roll your thumb and fingers together, and then release.